Good evening. Welcome to Health Quest. I'm Deborah Arneson, your host for the evening, and tonight we have a wonderful show. It's excellent information, so do not turn your dial or your clacker, whatever it is you use over there. And tonight we have David Grotto, and David Grotto is with us. He's actually the Director of Nutrition Services at the Block Medical Center up in Evanston, and he is the host of Let's Talk Health in Chicago, which is on every Saturday. If you want to tune in, give me a call. I'll tell you more about it. And he's a clinical licensed nutritionist and dietitian, so he comes with just this huge long lineage of like all kinds of little degrees behind his name, and an expert in the field of cancer nutrition, which is unfortunately a topic that really totally needs to be discussed and addressed because it's growing in America and throughout the world. We were talking before the show and David was telling me that it's now up to 1 out of 4 people who will die of cancer throughout the world, right?
North America.
In North America. Yeah. So thank you for being here,
well,
David.
on that happy note, yes.
It's great to have you here to share some great information. The goal tonight is to teach you and to give you some thought, anyway, about what it is you put into your body and how we can, first of all, help to prevent the onset of cancer and not to lower our immunity, and also what to do if you're going through chemo or radiation. So
absolutely.
We've got a lot to share with you. So anyway, tell us about how you became interested in this particular focus.
Sure. I know we have a short show, so I'll try not to take too much time.
Okay.
Back in the early 1980s, was working in a health food store. I actually started our own health food store. And I thought, gee, this is kind of a fun thing. I really like the idea of being able to go ahead and help people that are coming in here. And I really wanted to be a professional nutritionist. However, I was in a rock band and also going to Columbia College and wanted to become a DJ. And I said, you know what? I don't think I'm going to make any money doing this. So I wanted to become a nutritionist.
That's great.
Until I started having some own personal health problems, I didn't realize how important nutrition was going to be in my life. And so I decided to become a nutritionist and now worked primarily in the cancer field, though I do a lot of other nutrition counseling for other patients. But primarily the focus is in cancer.
So how did you come to be in the cancer field? I guess that's probably the best question because, you know, as a nutritionist myself, I refer everyone who deals with cancer pretty much out to you. It's a specialty, and it takes a lot of knowledge, a lot of knowledge, because everyone, as you know, is so biochemically individualized. And then on top of that, you have the effects of chemo and radiation sometimes together or back to back, which creates more havoc to the system. So how did you pick such a difficult field to help people within?
I don't know if it was certainly divine intervention, but I would certainly think my mother probably had a lot to do with it. My mother was diagnosed with metastatic breast cancer. And at the time that she was diagnosed, the prognosis didn't look very good at all. And my mother was kind of a unique anomaly in that she survived much longer than these other doctors thought. And I really started analyzing what it was that she was doing. And she believed very much in doing nutritional supplementation, making some improvements to the diet, but I'll be telling you the truth, Deborah, I think it had more to do with her positive attitude. And also not concentrating that she was a cancer patient and not buying into the fact that she was pronounced with death 6 months after her diagnosis. She went on several years after that.
That's marvelous.
So I was inspired by that, and I knew that all of this is really very much interconnected. Not only nutrition, obviously, which is our passion, but the understanding that a proper attitude, spiritual growth and development, exercise, all that really has a lot to do with surviving not only cancer, but many other different diseases.
So then, of course, we're looking at exercise, dietary adjustments, and just being a savvy consumer and knowing what to look out for out there is the most important thing of all in creating a preventive stance.
Absolutely.
Right?
Absolutely.
Okay, so tell me, what kind of patients do you work with the most?
Well, unfortunately, Deborah, as we were talking about earlier, that 1 in 4 Americans will die of cancer, unfortunately, every year. Unlike heart disease, it doesn't seem like that number is waning too much. And so there is a lot of research that's going into the field of nutrition and prevention for cancer. And the primary cancer patients that we see are breast and prostate. Those are generally the 2 most prevalent types of cancers that are occurring in America today. But the good news is, I feel like we're starting off on a negative note, but the good news is a lot can be done, and the title of cancer doesn't mean that it has to be a death sentence. As a matter of fact, we're seeing on a daily basis people who are certainly beating the odds. And of course, the things that we may have already heard, and I can't emphasize enough, is early detection and diagnosis certainly fares very well for the individual diagnosed with cancer.
And then what you do is not just nutrition therapy, it's integrative therapy. You work with the doctor who proceeds with the chemo and the radiation and the drugs, right?
That's right.
And the medications. So you have to kind of finely tune and balance people, which is hard. So do you feel, I know this is probably a passé question, but do you feel that nutrition has a correlation to developing or lowering or increasing your risk of developing cancer or a lack of nutrition?
Well, certainly, Deborah, the vast majority of cancers today that are being experienced are certainly attributed to lifestyle factors. So we definitely know that nutrition is a big factor. And so
is
obviously
that the first factor or the largest
that is
contributing?
definitely the largest factor.
So lack of nutrition meaning eating too many dead food choices, or?
Well, I think improper food choices, certainly we can talk about what's being done to the food, and certainly over the course of our lives we've seen a lot of changes in the food chain, so to speak, and the resources for food. So I think it's not only a matter of eating the right types of food, but also being very conscious about the quality of the food as well. But there's also, again, other things. I tend to try not to be a reductionist and look for the one thing that really is just attributed to cancer. Certainly nutrition is a big part of that, but I always encourage my patients not to forego those other things that we just talked about, the importance of doing exercise, spiritual growth and development, developing good relationships, and of course proper medical dental care all plays hand in hand.
Well, I was just reading an article, I don't recall where, last week about how people who are disconnected, don't have a close support group or one or two people that are close and supportive of them tend to fall prey more frequently than people who are not well supported, and they tend not to survive.
That's true.
Because they're so kind of free-floating.
Right, disjointed. Well, as a matter of fact, they've had a study in Italy that looked at a small town that was really more of a mining community, I believe. I'm not sure quite what the profession was that was prominent in that culture. But what they found is that when big industry moved into that culture, the families started separating and moving out to other different areas. And they found that heart disease and cancer was exponentially escalated in their village, where there was virtually non-existent any sort of cancer or heart disease.
So family's important,
Very
even
important.
if they drive you crazy. Okay.
Especially if
love mine. They drive me crazy. I love them. Okay, so are there certain foods or groups of foods that you find are linked with cancer? What would they be?
Well, if I had to certainly get across one message today is the importance of getting fresh fruits and vegetables in. Now, of course, we've all heard that about getting at least your 5+ servings of fruits and vegetables. But the more research that we've been coming across is really showing that especially with fighting cancer in today's society and what we're exposed to, that probably even much more than that is important. And I think the difficulty is the average American is not even eating 1% of what the U.S. Department of Agriculture has recommended in the food guide pyramid.
Which is pathetic to begin with.
Yes.
Right.
Well, there's of course a lot of controversy about how the food guide pyramid was developed, but it's scary to think that even less than 1% of the American culture is even following those guidelines. So the challenge is for nutritionists like ourselves is how do we get people to consume more of these vegetables? And of course there's a lot of other creative ways. Of course juicing is very popular, and of course there's a lot of different extracts that are now being developed that are whole fruit and vegetable concentrates, which also I think offer a lot of promise.
Now I have a question for you because I have read conflicting information on and the jury's kind of out on this. Like, let's say we sit down and we eat a pesticide-laden fruit or vegetable. Are the benefits, or do the benefits far outweigh the fact that we're eating something else, probably a dead or fried food or a phosphate, loaded soda or something? I'm certain that that would be a better choice. Do you feel the pesticides are a concern?
Well, I definitely think the pesticides are a concern, Deborah, and for sure they're even looking closely at prostate cancer possibly being strongly linked with pesticide residue and accumulation in the prostate gland. And of course what's interesting is prostate and breast cancer have a lot of similarities to it. And of course we can maybe make that one-step leap of faith and assume that breast cancer may have a strong link. But the good news is for the consumer is a lot of the pesticides can be reduced by actually vigorously washing your fruits and vegetables, even just in pure clean water. But for a lot of people who are receiving chemotherapy or radiation, and if their immune systems are being reduced, they are more susceptible to bacterial infection. That's why I really strongly recommend.
Washing.
I think it's even a good idea to wash it, maybe even do a little bit of a soak. Yes, I'm going to say bleach. I know a lot of people are probably cringing when they hear this, but a small amount of bleach in water actually does a very good job of
Can
killing
you give
bacteria.
us that ratio? I know there's a 5 gallon, or is it 5
That's
gallons
right.
of water to 1 teaspoon of
2
bleach?
tablespoons actually is
2
the
tablespoons?
maximum that you can go up to.
Okay.
Now most sinks are about 3 to 5 gallons.
Right.
And so if you fill that up, put 2 tablespoons of bleach, let the vegetables and fruits soak in there for about 10 minutes. That does the job.
Right. Well, you know, it's interesting because people are becoming so frustrated by the fact that there's so much bad, negative information out there. It's like, okay, fine, we're going to soak our fruits in the water. Now the water's polluted.
Right.
You know, it's like what to do, but the bleaching agent will get all the bacteria off. Will it help, like, cut through the residue, the wax on the fruits and vegetables at all?
Actually, they found that just the vigorous washing and scrubbing the fruits and
with the
vegetables
soft
probably
brush.
did the best job. And really the bleach's job is really just to decrease the amount of bacteria contamination.
That's great. Okay. So what foods do you think are the most provoking?
Well, I definitely think things that have words attached to it that you can't pronounce. I always tell my patients when reading a label, if there's words you come across that you can't pronounce or the list of ingredients is long, I think we've departed away from foods that were provided for us that we should have been eating all along. So the general rule of thumb is I think if you find it naturally occurring in nature, that's a real good point to look at and try to include more of those types of foods into your diet. But I generally like to start off with the basics of including fresh fruits, vegetables, whole grains. Avoid things, again, that are processed. You know, again, the further away from the way it occurred naturally is important. I certainly think the nitrates are an important aspect. We do see this a lot in cured meats. We are seeing a lot of...
What types of meats? Could you express that to us?
Sure, like bacon, smoked meats, even things like smoked salmon. We've seen a rise in the consumption of salmon because of the high of omega-3 fatty acids, which are so beneficial for preventing cancer. But then we combat that with being cured with preservatives like sodium nitrate and nitrites, which again may be a contributor for cancer.
Which is not good.
Not good.
So really look out for the smoked items.
Smoked items I think would be a good idea.
Yeah.
Certainly heavily laden fatty foods. Now we tend to love our fat, and we've seen a recent rebellion in the American public
I don't
against...
love my fat.
Right. We got very tired of all those Snackable Devil's Food cookies and said, give me the fat back in that cookie. But I think we've also seen some rebound ramifications of that. And what we're doing is actually including more of the wrong types of fat, Deborah. We're including way too much omega-6 fatty acids. And we're finding that actually helps create an environment that's conducive for cancer cell growth.
And where omega-6 is found primarily?
Well, typically corn oil. That's one of the prominent oils that we tend to use in a lot of our foods. A lot of processed foods have corn oil.
Do you think it's the processing, David, or the omega-6 itself?
Well, I think it's both. You know, we can also start talking about funny fats. You know, of course, we take that innocent corn oil and then we start bubbling hydrogen ions through it and making weird things like plastic hydrogenated fats. And I think also that has a lot to do with it too. But what's happened over the course of our evolution, and if you looked at this culture before it became industrialized, we ate a much higher ratio of omega-3 to omega-6 fatty acids, meaning that they were more equal. And we used to eat things like wild game in the Midwest and a lot more cold water fish and so forth. We kind of got away from that. So we have a real high level of omega-6 to omega-3, and now we got to start boosting up those omega-3s.
Okay. So how do you suggest people do that?
Okay.
How should the average consumer start doing that?
Well, there's a lot of controversy about this because, of course, we've all heard about the benefits of something called flaxseed. And flaxseed is a wonderful thing, does contain omega-3 fatty acids, but there's a difference between what are called short and long-chain omega-3 fatty acids. And the omega-3 fatty acids in flax have to convert over into these long chains, or basically alpha-linoleic acid converts into this more complicated omega-3 fatty acid. Unfortunately, flax does it at a very inefficient level. Now, however, don't get the wrong message. I think flax is a wonderful thing to include in the diet because of fiber and something called lignans, which help fight cancer. But the real payoff, Deborah, is I think adding cold, deep Northern Ocean fish.
Okay, so the EPA oils and the DHA.
Exactly.
Okay.
And of course we've seen studies, as you well know, about breastfed children and seeing that those natural omega-3
Right.
fatty acids are absent in a lot of the formulas that